Okay, I'm going to start off by looking at my MAR, making sure I have my 5 rights of medication. So the right medication would be the doctor's ordered morphine, 2.5 milligrams IV push every 4 hours as needed for pain. So I'm going to make sure that I get my morphine. It's a 4 milligram per milliliter bottle. So the right medication, the right dose, which is 2.5 milligrams. Got the right route, which is IV push, and then the right patient, which I would read the name on my MAR. And looking at my time, it's almost 10 o'clock, and the medicine is due at 10, so that's the right time. So we got right patient, meds, dose, route, and time. So I check to see on my MAR if I have any allergies, which I do not. So now my next step would be to make sure that everything is a safe dosage. So I look for my morphine in my book. For an IV injection, the usual dose is 2 to 10 milligrams per 70 kilograms of body weight. My patient weighs exactly 70 kilograms, so that is a safe dose. My dilution is for an IV injection. It says it may be given undiluted, so we will not be adding anything to our medicine. The rate of administration for an IV injection is a single dose over 4 to 5 minutes, which I would choose 5 minutes for the longer amount of time. I would check in the back to see if my morphine is compatible with my solution. The solution's already in the room, but I would look on my MAR and I would see that morphine, my patient has D5W in the room. I would check once I got in there again, but it is compatible with everything. Important information that I would need to know before going into the room would be I would need to monitor for respiratory depression, since this is an opioid analgesic. I would make sure that the oxygen is between 95 to 100%. I would assess the pain so we can properly evaluate once the medication is given. I would make sure the patient knows that if he needs to get up for using the bathroom or anything, to hit the call bell and let a nurse come in there and help him, since this will cause some sedative effects. If he's taking it at the house, he would avoid alcohol. So making sure everything is safe. So now, after I've done my math, I've gotten my volume. Since I'm going to choose to go over 5 minutes, my volume equals out to be 0.6 milliliters. So I would administer just about a little over 0.1 milliliters per minute, but approximately divided by 5, it's 0.12 milliliters. So now I'd start gathering all my equipment. Before I do that, I'm going to wash my hands. Okay, checking with my morphine for the second time. Would make sure that I have the appropriate bottle for my 3 checks of medicine. That's only the second. I would get my syringe with the needle already applied. I would get my label and 2 swabs of antiseptic. And I guess I would go ahead, take out the syringe, and leave it. Going to scrub the hub of my medication for about 15 seconds. Okay, allowing that to air dry. We'll go ahead and take the top off. I'm going to pull back about of air. I'll go ahead once it's dry, inject it, and put the air in. I'm gonna make sure I'm getting all the bubbles out. I'm going to 0.6. Does it work from the side? Like,
I think it showed it. Yeah, that did.
It did?
Mm-hmm.
Okay. 0.6. I'm going to recap. So everything remains sterile. I'll go ahead and label my syringe, letting it be known that it's morphine at 0.6 milliliters, and I put my initials. Yeah, I can see it on that. Okay, so everything's appropriately labeled. I would put all my equipment up that I need to discard. Okay, then I would get my syringe. Then I would head over to my patient's room. I would knock on the door, introduce myself. Hello, my name is Kennedy. I'll be your nurse today. I'm going to be giving you an IV push of morphine in order to help control your pain. With this, you may experience like some lightheadedness or dizziness or sweating. I would tell him if he experiences any of these side effects to just let us know. I would ask him to give me his name and date of birth. And that one's right, so we got the right patient. I would ask him to verbally allow me to, or tell me if he has any allergies, which he would say no. I'm going to assess the site, make sure there's no swelling or redness in order to see if it's patent. And I would also check again that we have D5W in the room, which we know is compatible. I would check for patency by lowering the bag and looking for blood return, and we see some, so we know it's open. Locating the hub closest to the patient. Before I touch anything, I'm going to wash my hands. I'm not going to put on gloves since it's not an IMT line. I would check and ask the patient if he can go ahead and rate his pain for me right now. We'll say he gives it at a 6. I'll count his respirations, make sure they're not depressed or lower than what they normally should be. I'm going to get about 16 breaths per minute, so that's within normal limits. Getting my alcoholic swab. I'm going to get the hub and I'm going to rub this for about 15 seconds. Okay, put it down, making sure it stays sterile. My solution, and also before giving the medication, I would let the patient know if he needs to stand up for any reason after it's given, or if he feels any unusual pain in his arm, to just let me know, and do not try to get up by himself because it causes sedation and he could fall, so it's a safety risk. I'm going to take my needle off, grab the hub without touching it. Okay, we've got this attached, and now I'm going to begin my time. And now that I've got this kinked, I'm going to administer a little over 1 milliliter. I'm going to unkink it. We're going to wait a full minute until the next dose. What's my timing on the video?
11.
Okay, gonna apply the next milliliter. Kinking the tubing. I'll release it. Okay, gonna administer the next one. Kink the tubing again. A little over 1 milliliter. I'm kinking the tubing. And while I'm doing this, I'm still going to assess my patient's respirations, make sure it doesn't get too low. Okay, gonna put the fourth one in. A little over 1 milliliter. Unkink. Okay, for the last dose, gonna kink the tubing one more time. Administer the rest. Now unkink it. Assess the site. Make sure that the patient has tolerated it well. There's no swelling, no redness. Just gonna put that back down. Seems that the patient has tolerated it well. I'll come back and assess in like 10 minutes to check the pain, see if the medication has worked correctly, and I will go ahead and get rid of all my sharps. Discard in the trash. And I guess I would lower the bed, side rails up, make sure that, again, he remembers not to get up, make sure his call bell is near so that he can use it if he needs anything, and then I would document.